Hello and welcome from today's CPR educational video. This video will demonstrate the proper ways on how to perform CPR to the infants ages up to 1 year of age. And also, this video will show you the proper ways to respond for potential choking. But what is CPR? CPR is short for cardiopulmonary resuscitation. It is the action of pressing hard or compressing the chest in giving breath to an infant. The CPR keeps the oxygen and the blood flowing when the infant's heart stops beating. Never be afraid to perform CPR because any CPR is better than no CPR. Let's get started. If you found an unresponsive infant, check for responsiveness like tapping the infant's foot and shout, "Baby, baby, are you okay?" Did the baby move, cough, or blink, or show any signs of life? Now, let's try it with the mannequin. "Baby, baby, are you okay? Are you okay?" Did the baby respond? If no response, yell for help. "Help! Help! I can't wake the baby up." If someone is there, have them to call the 911. "Hey, you in the blue shirt, call 911. And if you are all by yourself, you need to perform 5 cycles of CPR. Don't you worry about the 5 cycles of CPR because you will learn of that throughout this video. Now, let's start the CPR by moving the clothes away out of the airway and check for infant's chest and belly. Then, scan for the breathing from the head up to the belly. Scan for it for like 5 seconds and not more than 10 seconds. Did the baby move? Or did the baby breathe? Or could the baby be gasping? Remember, gasping is not a normal breathing. It is a rapid sucking in of air, and it's not normal. So, if the baby is not moving, nor breathing, or not even gasping, then let's start the CPR. To start CPR, we need to give 30 compressions and 2 breaths until the baby wakes up and started breathing, or until someone can take over for you. If you are alone, you need to perform 5 cycles of CPR and then call 911 and put your phone on speaker so that the emergency staff can communicate with you. Let's practice infant CPR. 1 cycle is equal to 30 compressions plus 2 breaths. So, we will perform the first 2 compressions. Place your hand across the mid-nipple line, over the lower half of the sternum, and place your other hand on the infant's forehead to keep the airway open. You are now in the position to start the CPR. Compress or push down at least 1/3 of the depth of the chest, or approximately 1.5 inches, or until you feel resistance. We're gonna give 30 compressions at a fast rate because we're trying to achieve 100 to 120 compressions per minute. Be sure to allow the chest to rise back up for a normal position after each compression, and then you should count out loud. Ready? Let's show you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now that we're done with the 30 compressions, we will gonna give 2 breaths. Now let's practice how to give 2 breaths. We're gonna place our hand on the infant's forehead and place 2 fingers on the bony part of the chin of the baby and tilt it backwards to keep the airway open. Okay. Place your one hand on the infant's forehead, and then the 2 fingers on the infant's chin, and cover the infant's mouth and nose by your mouth, and then give 2 breaths. Let's go. If the chest of the infant didn't rise, reposition the infant's head and then give again 2 breaths. Now that we're done, we will gonna perform now the whole sequence of the procedure. So let's assume that we are babysitting a 4-month-old baby and we're about to prepare the bottle of milk for her, and we found her unresponsive. And we are alone in this scenario. Let's go. Baby! Baby! Wake up! Wake up! Baby in here, and I found her unresponsive. Please come here immediately. That's all for today, guys. I hope you found this instructional video helpful. Thanks for learning with us.